A nationwide lockdown is underway across England and Scotland, with authorities warning that it could last till March. The country has entered a third lockdown to control the spread of a new, more infectious COVID-19 strain. Authorities are also considering tougher border controls as it races to vaccinate as many people as possible. Coronavirus infections have been rising rapidly across Britain, threatening to overwhelm the healthcare system. Ollie Barrett joins us live now from London for more. Ollie, another lockdown. What are the measures this time?
That's right. The lockdown that Boris Johnson has announced relates to England, and it involves this time around school closures. So all primary and secondary schools are shutting. The large parts of the country were already in pretty tough Tier 4 restrictions anyway, but now the whole country is in the same boat when it comes to England. Hospitality is shut except for takeaway. Outdoor leisure facilities are completely shut down as well, golf courses, etc. Amateur sports have to stop. Elite sport can continue, so the Premier League will remain on football screens around the world, but real tough restrictions now being reimposed for a third time in terms of a national lockdown in England. More business support announced, though, as well. The Chancellor Rishi Sunak announcing new business grants worth around $6 billion or around 10 or 11,000 US dollars per individual business in the retail, hospitality or leisure sector that has to shut down. In terms of how long all this might be in place, there will be a review in the week of February the 15th, so these measures could well be in place until March.
Ollie, we understand that due to the increasing numbers of COVID infections, hospitals are hitting their limits, but the government also is aiming to vaccinate 2 million people a week. Is that realistic?
Well, this is a big part of Boris Johnson's claim to the country that the lockdown is necessary, was him saying that the medical advice that he's getting is that the NHS, the National Health Service, could be overwhelmed in the next 3 weeks if these measures aren't taken. At the moment, the NHS has, throughout this crisis, avoided that picture of becoming completely overwhelmed, and Boris Johnson wants to continue to avoid that. And a big part of his pitch to the British people in terms of this new lockdown was being able to say that there is light at the end of the tunnel in terms of vaccine rollouts. And as you say, that target of around 2 million vaccinations a week is something that the UK government believes it can hit. Boris Johnson says that by the middle of February, he wants everyone in the top 4 priority categories for vaccination to have been inoculated. So that's all the over 70s, NHS workers and staff on the front line, care home residents, and also the clinically vulnerable. That is a lofty ambition, but if hit in mid-February, Boris Johnson believes that's the moment at which restrictions can start to be eased, because hospitalisations and fatalities would start to be coming down in a noticeable way.
Meantime, travel curbs are also being looked at. Ollie, do we know right now what they are?
The government is considering some further restrictions on international routes into the UK, and also a new testing regime by which travellers would have to have a negative test before they could make their way into Britain. Critics of the government say that is something that other countries have been doing for months and months. The UK government's policy at this point has been that testing would not make a huge difference and that quarantine was the way forward. But again, critics of the government have said that the quarantine policy for international arrivals has not been particularly strictly enforced here. But we are clearly at a point in the outbreak here in Britain now at which ministers believe that further restrictions on international travel are necessary.
All right, many thanks for that. Ollie Barrett speaking to us from London.